All right, so let's get straight to it. When were you diagnosed with diabetes, and how was your health at that time?
I was diagnosed in 2014, and my health wasn't the best. I had a lot of other health issues, and then diabetes was just added to it. So,
What were some of those health issues?
I would say living with lymphedema uncontrolled. Because lymphedema, you can't heal it per se, but you can control it to where you live without symptoms for the most part.
So yeah, for those who don't know what lymphedema is, it's basically swelling in your limbs, your extremities especially. That makes it very hard and painful to do even simple things, right? And especially exercising can be hard. So about 8 years ago, you're diagnosed with diabetes. But I think it's kind of funny, the story of finding out before you knew you had diabetes, what was going on, and besides your lymphedema.
I was drinking a lot of water, very thirsty, and of course you drink so much water you have to go to the bathroom a lot. And thank God that Lewis went to medical school, PA school, whatever you call it, because if it was only for Lewis, I would be dead right now. Because he would constantly take water from me, tell me, don't drink no more water, control yourself. He wouldn't stop the car for me to pee.
So most people don't know this story, but I wasn't a PA then, right? So when you see somebody drinking water, like there's no tomorrow and peeing all the time, you think, okay, well, one is tied to the other. Stop drinking the water and you won't pee so much. So, of course, we had we can laugh about it now, but it was pretty frustrating to see you always down in another bottle of water and run into the bathroom, not knowing it was because your sugars were probably in the 400s at that point.
Oh, 500s.
500s, We didn't know about diabetes much 8 years ago. At least me and you didn't. This is pre-medical school, pre-PA school. Of course, we know a lot more now. But you got the diagnosis of diabetes, and so what treatments did they start you on?
They started me on insulin, and I had metformin as well. Insulin and metformin.
Okay. Yep.
Right.
So insulin, metformin, very common medications for diabetes. Was it successful?
No.
Yeah?
No, it wasn't.
So, and that was just one of many medications. What other medications have you tried?
Throughout the years, I was on some medications for my nerves as well. So I don't know who is who, but I was on Januvia, glipizide, Ozempic, Victoza, and insulin. Insulin now on and off, but
and you were gaining weight on insulin too, right?
Yes,
which is something you didn't like.
30 pounds on insulin, and when the doctor told me that's normal, I decided never to take insulin again.
Yeah.
Unfortunate
side effect of insulin. So you're frustrated because your sugars are still high. You're on all these medications. How high was your A1C at the highest?
12.1.
12.1 at the highest, right? And I'm sure it came down with medications, though, right? Was there some improvement?
No, not to my knowledge. I never had a doctor excited about my numbers ever.
Yeah, because it wasn't.
So my diabetes is different from everybody else, and I strongly believe that. But
you got that stubborn diabetes, right? Yeah. And of course, as a physician assistant now, I know that there's a lot of people like you that are on multiple medications and still having a hard time getting their sugars under control. There's also those who can manage their sugars with medications, but another frustration for you, would you say, probably is the side effects you had with medications?
Yes.
Yeah.
Yes.
So
especially with the Januvia side effects were very much more noticeable than all the other medications, because all medications have side effects.
Yeah. And then a lot of times the doctor had to stop a medication because it wasn't agreeing with you, right?
Yeah, but after you fight with them, because they don't want to stop the medication either. So you have to ask them to change the medication, and convince them that your side effects are the same side effects that are on the, what that paper that comes in the,
Like black box warning, or what do you mean?
the warning on the side effects warnings on the medication that comes in every box. I don't know. We say bijsluiter in Dutch. I don't know the English word, but yeah, I had all of the side effects, and she was still trying to convince me that
it would get better.
It was something else. It wasn't even tied to the medication.
Okay.
Yeah.
Yeah. So you were sensitive to these medications, side effects. They weren't even when you were taking them. They weren't, because these medications do take some time to work, but they weren't working well for you. So you were frustrated.
Yeah, very frustrated.
What else did you try? Different diets? Did you?
Yeah, because of the frustration I had in reading all the side effects of medication, I know it wasn't a way of life for me. And when I worked in the hospital, it really opened my eyes to see all these compliant patients taking their medications, doing what the doctor says, and they are all on the diabetic ward, getting leg amputated, going blind and stuff like that. So I knew that I had to find something so I don't end up like that. I don't want to live on medication or having to have stuff chopped off.
Yeah. And that's something that most physicians don't really tell their patients, or maybe they're not privy that even when you take the medications and you're compliant, you still suffer a lot of the complications of diabetes.
You do. And I know my doctor in West Virginia, she used to always say, "You're so non-compliant," and she would be so frustrated with me, and I couldn't care less because I have diabetes and not you, and I don't want to end up like those other people, unfortunately for them,
And my experience is unique, I guess, and helpful because usually we can be pretty judgmental as physicians and thinking that our patients are non-compliant because their numbers aren't what we want them to be. But I was living with you and seeing you do what the doctor's telling you to do, and your numbers still weren't ideal. So something was missing, right? Something was missing. So you tried different diets. You tried keto diet, right?
Yes, I did keto.
You did vegetarian diet.
I did a vegetarian. I was vegan actually for 9 years.
Okay.
And actually, yes, within that 9 years, 2 years, we did the raw vegan diet.
Okay. So
it was sad that I was diagnosed after that. But I have
so
an
let's
idea
pause there. So this is interesting. You're unique in a lot of ways. So you were actually diagnosed with diabetes after being on a very typically healthy diet, consisting of majority foods being plant-based, but also raw, uncooked.
Yeah. Everything that you can eat in a raw state,
and that's where obviously probably that wasn't what caused you to have diabetes, because we know diabetes can develop over a 10-year span, but it definitely didn't avert it either.
No,
right?
But when I was on the raw vegan diet, I was over 200 pounds.
And you were overweight,
I was overweight.
Yeah.
I mean, I lost 50 pounds doing the raw vegan diet, but my body was already sick before then.
Yeah.
So I don't blame it on the raw vegan diet at all. Yeah. Knowing what I know now about the fat percentage, I definitely had way too much fat on the raw vegan diet. And
we could talk so much, and I just for time's sake, I'm going to try to speed a little bit through here. So you tried different diets. The most effective diet was probably the keto diet, right? Yeah. Because even the vegan or the low carb diets you tried, your sugars are still high even on low carb. But it wasn't until you tried keto that you started getting improvements. Yeah. But there was a cost.
It was good because the same doctor she couldn't believe that I dropped my A1C from 12.1 to 7.9 in a short space of time, and she was so shocked. But the keto diet is not a diet that you can live on for a long time because it's so restrictive, and that is where I had to come off of it because I got so tired of eating animal products and not being able to eat fruits and
Yeah.
other stuff.
So you were tired of the keto diet. It was working, but you said, you know what? I'm tired of eating this way. So how did you learn about this new approach, low-fat, whole-food, plant-based diet?
You was studying, I guess.
Enter me. So, yeah.
Yes.
So I mean, obviously, my wife is tired of this diabetes. We knew at that point that plant-based diets was the way to go, but it wasn't until I did a lot of research and reading over months and just pouring into the nutritional evidence that's out there, right? That there was a connection that we were missing, right?
Yeah.
What bridged the gap really to heal diabetes was addressing the fat percentage, right? When we finally got you on a low-fat plant-based diet,
Yeah.
how long did it take for your sugars to get better?
In 6 weeks.
6 weeks, y'all.
To be off of medication.
So
Yeah.
after 8 years of diabetes, simply addressing the fat component while eating, and you were eating fruits, right? And
yeah.
carbs were
Yeah.
not a problem, right? And of course, your sugars were high for a while.
Yes. It
During-
looked like it wasn't going to
It
work.
looked like it wasn't
but
working.
You kept telling me,
But I
let's
said,
wait.
it
let's
takes some
wait,
time for the body to heal itself, and it did. And so you got your sugars under control, and it only took 6 weeks.
Yeah.
Now, are you on medicine now?
No.
Still not on medication, right?
No, I don't want to go back on medication either.
Yes. You feel better. You've lost some weight.
Yes, I lost. Now that I started lifting weights, I can't really tell how much weight I lost, but I know I lost a lot of fat because I had to change my wardrobe.
Yeah. She gets a lot of compliments on the road, right?
Mm-hmm.
Yeah. Unfortunately, but of course, most of your compliments are from me. She's looking good, y'all. I mean, she's always looked good, but
please.
yeah. But it's just amazing too when you start exercising and getting lean muscle, losing fat. Your body, your scale may not change, but your body composition changes, right? Eating this way. So that's awesome. Where do you think you would be health-wise if you didn't make this change?
I think I would have been dead by now because my sugars were very out of control. Like fasting, I would be in the 400s fasting, and a lot of times my meter said high. It couldn't even read my sugars. So I know I wouldn't have lasted too long because of how severe my diabetes was.
Your vision was changing too?
Yeah, my vision. That's actually one of the signs too that I got early on. I couldn't drive for almost 2 weeks because of my eyesight being, and that's how I started wearing glasses. So
before we get to our last question, I think it's important to highlight, just how huge this transformation is. So your sugars on a daily basis probably were, 300, 400s, right?
500.
And that was a normal day for you.
Yep.
Now when you check your blood sugar, what do you usually get?
The lowest I ever got was 87,
Yeah.
but it's usually between like 93 to the low 100s.
Amazing.
Yeah.
Amazing. And you eat carbs, right?
I do.
A lot of carbs,
I do.
right?
I
And you're not
do.
supposed to eat carbs though. You're a diabetic. What are you doing?
Yeah.
So-
I'm not on the keto plan, so
Yeah. So, last question for those. There's a lot of people who are skeptical when it comes to this carb-rich diet, this carb-centered diet. Low in fat, or they're on the fence about it. They're hesitant. They're thinking about it, but there are a lot of questions like, can I do it? Does it work? Can I really eat that way? What would you tell those who are on the fence or skeptical?
it just depends on how you how you say, how you would feel, about your daily life when it comes to being on medication. If you want to live a life of being on medication and living with the side effects of medication, then you wouldn't want to have a change really. But for me, I know living on medication is not going to work for me. So I would say just try it out but have a support system, because I wanted to give up many times in those 6 weeks, thinking that this diet was yet another one that wasn't truly going to work. But having you there to support me really kept me going. So you just have to keep going and the numbers will come down. I don't think anybody's diabetes is like mine, so you'll be fine.
Yeah, hers is the worst it could get.
Yeah.
So thanks for that. Actually, I know this is going to be a question. So like, we talk about the raw food diet, being on raw food, plant-based, and still being diagnosed with diabetes. The reason most likely you were still diagnosed, you still developed diabetes on that diet is because even a plant-based diet can be high in fat.
Yeah, but I was already, I had to have been already pre-diabetic.
Most likely.
When we started that program, being over 200 pounds.
Yeah.
I mean,
yeah.
you're not healthy.
Yeah. And so you add that on top of that you can be plant-based and still have a lot of fat in your diet with the oil, avocados, nuts.
Yeah,
so
we eat a lot of nuts.
I want to highlight, it wasn't until we addressed the fat in the plant-based that things work for you. All right, I think that covers it.
All right.
Good job.